that. And then you would go in with a cannulation wire.
There's no depth, so they would monitor this with the fluoroscopy or that
Yeah.
C-arm thing?
Yeah, they'd watch.
Okay.
They'd check it.
Because they want to make sure it's aligned exactly right as well,
Right.
right?
Yeah.
Side to side and...
Yeah, they would check this with the fluoro as they went, you know, when they lined it up for center.
Okay. So you're just winging it then?
So, yep.
Okay.
I've done enough sawbones that I'm usually pretty close.
Now what that's doing is reaming it, Jacob, so that we can put the saw in there and cut the pedicle from the inside out.
Okay. Yeah.
What was that shot out?
A piece of bone. See, now with this big piece now that reams that big circle out.
You want a shoulder there, right?
Yeah.
Makes a little counter bore that you can reference all your tools off of there after.
Okay. So I'm not used to having a reamer that does that well. You know, gives you that surface like that. The old reamer didn't do that for you. So then you'd go down with the bone saw to the hole. You take that out. Push that
To
till
the
it's
shoulder,
seated.
right? Yeah,
Yep.
good.
So that's what that reamer cleans the shoulder out for you now.
This was designed so that saw would cut about the center of the pedicle? Is that-
Well, I mean, the goal is, and you would check that with fluoro, you'd want the bottom of this reamer to line up with the bottom of that pedicle. And I guessed at it.
But yeah, they cut it off right at the bottom
You want
of the
it-
neck.
you want it to be at the
okay,
bottom.
not the center, okay.
Yeah, you want it at the bottom of the
Oh,
pedicle.
that makes sense.
So right here at the base.
Yeah.
So now we're at zero. Zero is where it's actually. So how do we know?
Right here's the line.
So that was the line.
Yeah.
Okay. See, I thought it looked like the line was up here to me. That's just the.
That's the mark. I got to be careful of that. That's a mark from trying to use the press.
Oh, yeah,
okay.
we gotta
So-
fix that.
Yeah.
So what that does, each click extends that blade in here out about a millimeter or...
So I'm going to use this like a torque limiter too, right?
Mm-hmm.
So if I go too far, it should limit the torque.
Because if it gets in there and it gets bound up, you want it to not to bend the blade.
Okay.
That's what the torque limiter.
And the real bone will be tougher than this one.
It depends, I
Yeah.
guess, how old the patient is.
Um,
The younger the patient, the harder the bone, right?
Yeah, typically.
And they'll probably put one side in at a time because, in our case, if we cut both sides, it's gonna just
Right.
wrap around.
Right.
Because there's no nerve bundle or anything. Well, it still wouldn't be a nerve bundle. It'd be like a laminectomy then.
Yeah, I mean you have the nerve here that the
Right.
this is your spinal cord, and then
Right.
you have nerves coming out
Mhm.
here.
okay.
Right. So it wouldn't come apart in a
No.
cadaver or
No, you can cut both pedicles,
yeah.
and you can't tell. I mean, you have to like grab it and wiggle it to
Okay.
tell that it's.
Are you doing a couple clicks at a time?
Yeah. In this bone, it's so soft.
You
That
can't
you-
even feel it
Yeah.
cut, can you?
You can feel
So
it.
you can see it starting to cut, Jacob.
See, if go ahead, you can cut. You can feel it when it's hitting the outside shell.
Oh yeah.
Now, if you click it a
Like
couple
grinding,
times,
too.
you can
Oh, nice. It's cutting very nice and easy.
yeah. See, and as long as you turn it with the purple handle, it should stop and click before it'll break
Oh
the
yeah.
blade.
So if I grab the here, that's what Greg. Why
Right.
he wanted to limit that size.
Right.
So I can look and see that I'm at about 7
Mm-hmm.
centimeters, right?
Millimeters.
Millimeters. Is it all the way through? No, not the back.
And that's where they can do zonal cutting. So they'll
You
do all
just
the
go
way
back and
around,
forth.
and then when you get to the edges, you can do zonal where you.
That way you don't hit the nerves on this side.
Right.
Mm.
So when I do a sawbones, I don't. It takes a lot longer to do it that way, and I don't bother. But so now we're gonna be, because I've got a little bit of angle this way on it.
Yeah.
It's gonna cut deeper here, so it's gonna go further out.
Yeah. Yeah, it's pretty far down, isn't it?
Mm-hmm. But that's because of my angle.
Yeah.
I have it angled back just a little bit too much.
If you had an X-ray, you'd be able to see where you were.
Right. I'm guessing you're probably all the way out, pretty close.
Yeah.
That way. Is it extending anymore?
Yeah, there's
Is
a
it
little bit
clicking?
left over, but
You can extend it all the way to the bottom stop, but yeah, that's when it quits clicking, is when it's at the bottom.
Yeah. So if it's quit, it's not clicking anymore.
right.
So yeah, so when it quits clicking, you've extended it. I mean, that's one of the things we need to mention is that if it quits clicking, you've extended it as far as it'll go.
Right.
And that's where Greg's using it to actually, he gets, 90% cut, and then the screw will pop the bone.
Right.
Fracture
So
that last little piece off when you separate it.
Oh.
Right. So we'll put a screw in.
Implants.
You want to? Wait. You want to?
Oh,
We know we need to ream with
Ream
the
it
second
and tap
reamer.
it.
Right.
That's what we got to remember. I think you guys have to remember because
Oh,
when I was talking with Greg
this
about
is
this,
where
he
you
thought
would
we only
use
had
this
one reamer anymore.
to
Oh.
find it and put your wire
Put
back
that
in.
in. Put your guide wire back in. And you'd go down over the guide wire with your reamer.
So this is shaped for the shape of the thread.
And you take your guide. You can leave your guide wire in or take it out. It's in my way, so. So now you've reamed it.
Go to the shoulder as well.
So it can't over ream,
right.
which is phenomenal compared to what it used to be.
So
it used to
then-
could over ream, and then if you over reamed, you could cause all kinds of other
You
problems.
can also tap it. This is really soft, so we won't.
We really don't need to tap it.
Yeah.
But we'll do
I
it
want
just
to
to,
watch it.
we'll tap it
Just to test the.
Now there is no
Ne-
shoulder on this, so you
right.
could over
So
tap
you
it.
could over tap
Yeah.
it. So that is a concern actually. So we'll just tap it we went to the end of the threads. So this would be better if it had a shoulder on it.
Yeah, I agree.
The thing is, Greg was afraid if it had a shoulder on it that some doctor would over tap it
And strip
and
the threads
and
out.
Oh,
just crack the whole bone when the shoulder hit,
Right.
or strip the threads.
okay. Implants.
And what this is for is if there's a pinched nerve in here because of a bad disc or something, then this raises the whole pedicle system up to unpinch that nerve.
Now, typically what you do is you do the other side now.
Yeah.
Do we want to go ahead and do the other side?
Yeah.
So we.
That's just go ahead and do a full case.